Hello, everyone. Welcome. It's really so lovely to be here today and to be able to welcome you to today's session. My name is Wendell, and I am part of the Australian Volunteers Program. I'm based here in Johannesburg in South Africa, and we're so pleased to be partnering with the SVRI team on this webinar series. So today's session is the second webinar in this virtual series, Voices from the SVRI Forum 2024, Strengthening the Field Through Shared Learning. And our webinar today aims to unpack key findings, to deepen discussion around various themes that have emerged from the SVRI Forum in 2024 in Cape Town. So earlier today, we hosted a wonderful session with the Asia and the Pacific time zones. And that session was titled Building Safer Futures, Evolving Approaches to Economic Empowerment. And it was a really interesting session where participants shared powerful insights and reflections. For those who missed it, the recordings will be up online. I think Liesl mentioned they are already there. So go across to the SVRI resources and knowledge sharing section, and you'll be able to pick up those recordings. You can also pick up the wonderful webinar that we hosted in April around technology-facilitated gender-based violence, and those two recordings are also up there on the page. So go and have a browse and listen to some of those wonderful webinars. So I will go on to some quick housekeeping notes just to make sure that we're all on the same page. So today's session will run for 1 hour, and Lovely Joy will keep us on track. All the sessions are being recorded, so if you're keen, share those with others and go across and look at all the wonderful resources on the SVRI page. So all audience members are muted, but we'd love to hear from you. So introduce yourself in the chat function, tell us who you are, where you're joining from, and introduce yourself there so we know who's in the audience. We'd love to hear your thoughts, reflections, and questions. So please feel free. So go into the chat box at the bottom or type in your comments into the chat function, and we'll do our best to go through those questions and comments and bring those into the conversation as time allows. So just to go on to look at our agenda for the day. So we'll bring in some of the key findings from the SVRI Forum. So those will be around the thematic focus of today, which is economic empowerment and violence prevention. This will then be followed by a moderated panel discussion with our wonderful invited speakers. We'll then have some opportunity to move into a live Q&A session with the questions that you pop into the boxes, the chat box. And then we'll close looking at the next steps and to share the upcoming webinar topic in June. So a little introduction of Joy Watson, today's moderator of the session. Joy is part of the SVRI team, and she'll be guiding us through the discussion as well as the question and answer session. So it's lovely to have you with us today, Joy, and wonderful for your facilitation. So before we begin the conversation, I'd like to invite Liz, the lovely Executive Director of SVRI, to share a high-level overview of some of the forum findings related to economic empowerment and violence prevention. Over to you, Liz.
Thank you so much, Wendell, and thank you to AVP for partnering with us on this learning webinar series. So next slide, please, Liesl. So today we're talking about women's economic empowerment. So what is women's economic empowerment? It's more than just having a job or earning an income. It's about women having the freedom and the ability to make choices about how we earn, spend, and save their money. It's also about having real control over things like land, property, other assets, and not just assets, or not just access, but actual ownership and the power to decide about how we use these resources. And very importantly, it's about us having a voice in decisions that are made at home, in our communities, and in our workplaces, and helping to shift the systems and the structures that shape all of our lives. And social safety nets like the things that we're going to be talking about in this webinar, like cash transfers, in-kind support, or public works programs, play such a vital role. They help us and our families get through really tough times like job loss, illness, climate change, and to bounce back just more quickly. So I'm going to be taking you through some of the high-level lessons, as Wendell spoke about, that we heard at the forum about these types of programs. But of course, we have a bunch of incredible people to hear about the work that they have both shared at the forum and that they've been working on for many years about where the field is at in our understanding of women's economic empowerment and where we should be heading. Next slide, please, Liesel. So what are some of the key lessons? Lesson number 1 is economic security can reduce intimate partner violence. Shalini, one of our panelists, is going to share more about a really great 2-year randomized control trial that they ran in Bangladesh, which the team followed up 9 years later. It's one of the very few longitudinal studies that we have in the field, which is just incredible. The study worked with young mothers and their children and compared the impact of monthly cash or food transfers, some with group-based behaviour change sessions and some without. Shalini will talk more about what that means in practice. But just to say, the results are really encouraging, saying that cash, when combined with behaviour change communication, did lead to long-term reductions in intimate partner violence. And cash on its own also helped, though the effects did take some longer time to show. And food support on the other hand was not as effective. But what really made the difference was sustained economic security, especially in combination with social support, confidence building, and peer connections. So that brings me to lesson number 2. Next slide, please, Liesel. How we design and deliver our programs really matters. I know to many of us on this call, that's not a surprise. But another really interesting study shared at the forum that was done in Ethiopia looked at how programs are delivered, specifically through group-based activities linked to what was called or is called the Productive Safety Net Program. And the researchers wanted to know, does using a group-based model make a difference when it comes to reducing intimate partner violence in its simplest form? And what they found was that great news is it did, that being part of what is known as a Village Economic and Savings Association really helped improve people's financial security. It helped them build stronger social networks, and especially for women, and it improved how decisions were being made in the home. But what really stood out in this program is that men and women experienced these benefits differently. Men said that the program gave them more status in the community, while women talked about feeling more confident and better connected to others in the community. So the lesson here is that how we design and deliver programs really does matter, and we need to pay attention to the different ways in which men and women experience and benefit from these programs. But that brings us to the next lesson. Economic empowerment can trigger backlash. It's something that we're all experiencing in the world right now. And we do assume that many programs will automatically reduce violence, but that's not always the case. Research is showing us that when women's financial independence is seen as a threat to male control, it can lead to backlash, and at times has been shown to increase the risk of intimate partner violence. Of course, this is complex, but that's why these types of programs shouldn't just focus on supporting women. They have to be working in concert with men and communities to really shift harmful norms and build more equal relationships, including life skills trainings, confidence building, peer support. Involving families and in-laws can even help make programs safer and more effective. So if these programs aren't designed with gender in mind, they can do more harm than good. So next lesson, please, or next slide for lesson 4. Integrating IPV prevention into social protection systems also works. We're seeing more and more evidence from findings from work being done by the World Bank, for example, the UN, other large infrastructural development programs, and from the forum discussions, that when government-led programs include gender-responsive strategies, they can create change at scale. But the important thing to note is this doesn't happen by accident. It takes really intentional design, good funding, and strong systems to make sure things are actually delivered as we are planned, as the program is planned. And that programs work best when they include clear gender goals like offering financial literacy training, access to things like childcare, services that directly respond to women's needs. And one thing that is coming up a lot is that cascade training that comes from the top down, often doesn't work very well. It falls short. They really rarely lead to real change unless the materials are adapted to local contexts. So context really matters, that they're simplified for easy delivery and backed by solid supervision and support. So next slide, please, Liesel. So lesson 6 was policy matters. Education and legal reform have been shown to be important empowerment tools. One of the big takeaways is from a presentation from Laurie Heisey and Rachel Perotti's work, that policy change can be a powerful tool for preventing intimate partner violence. In their preliminary study, they showed that things like education stipends for girls, like they shared in Bangladesh, and compulsory schooling laws in countries like Turkey and Peru, did help reduce violence over time. And they also showed that legal reforms matter. In Rwanda, recognizing IPV as grounds for divorce, or in countries like Spain and the US, introducing no-fault divorce laws. These kinds of changes were shown to shift power and create safer, more supportive environments for women. And these policy levers are really key, but are often overlooked in program design. So they really help us build a broader enabling environment that we need to ensure that women's rights, economic inclusion, and long-term safety are achieved. So lesson 6, tech and media are tools that potentially are untapped or have untapped potential. We are seeing much more use of digital platforms and media campaigns to raise awareness. So we know Nancy Glass on the panel today has been doing a lot of work around connecting women to services through using online applications, but they also, there are others that offer financial education. And so there's so much potential here. At the forum, however, there were some participants highlighting that while these tools can be powerful, they need to be thoughtfully and carefully adapted to different contexts and tested properly to make sure that they really are safe and effective and actually doing what we want them to do. Next slide, please, Liesel. Lesson 7. We know that sustainable economic empowerment needs funding, but it needs more than one funder. And programs are often funded by a mix of governments, by donors, foundations. NGOs are often required to deliver them in partnership with government, and they also need to be engaging with the private sector. And while government funding and government is key for long-term scale, many programs still rely on short-term or external support, which we are learning right now can disappear when priorities change. So to build programs that last, we need a more sustainable mix of funding, combining public investment, donor funding, private sector involvement, and community engagement. Having different funding sources will ensure and help make sure our programs just keep going, making them more resilient, and ensure that they do stay connected to the real needs on the ground. So next slide, please. So the forum presentations have really shown us that when economic empowerment programs are done well, they can strengthen women's safety, our dignity, and help us access support. But if they're rushed, they overlook local realities and the deeper drivers of violence. They can sometimes do more harm than good. And as we've heard, truly sustainable economic empowerment needs more than one source of funding, and we need more funding. And we need more and better funding. As a field, it's time to move beyond small pilots and start investing in more integrated long-term approaches. And in this panel, we're going to hear from the people who've been doing just that, putting in the work over many years to understand what it really does take to make these programs effective, safe, and lasting. But before we dive into this panel, I'm going to hand over to Liesel to tell us a little bit more about SVRI Forum 2026. Over to you, Liesel.
Thank you, Liz. Hello, everyone, and thank you for joining us today. I'm Lisa Lutz, the Global Partnerships and Network Manager for the SVRI. And I'm delighted to invite you to the next SVRI Forum, which will take place at the Sentara Grand and Bangkok Convention Center at Central World in Thailand from the 5th until the 9th of October 2026. So over 5 days, we'll bring together researchers, practitioners, policymakers, donors, survivors, activists, and others from around the world to share evidence, build collaborations, and drive forward solutions to prevent violence against women and violence against children. Abstract submissions open early August 2025, so do start shaping your ideas now. Our themes have recently been published and launched this morning. And it was developed in deep collaboration with the field. So do have a look as they will guide the submissions. And Liz will add the link to that in the chat. To stay up to date on submissions and deadlines, I'm just putting our contact details up. But do follow us on social media at the SVRI. And do subscribe to our forum newsletter. You can go to the SVRI Forum 2026 website, and there will be a link to sign up. So we can't wait for you to join us there. And I am now going to hand back to Wendell. So that's Wendell, you've introduced Joy, so I can just hand over to Joy from here, right? Perfect. Over to you.
Thanks so much, Liesl, and a warm welcome to everyone. It's so exciting to be having this conversation today, particularly in light of the fact that there was great demand at the SVRI Forum 2024 for a series of ongoing conversations where we have a sort of mini SVRI sessions in between SVRI forums. And I'm so excited about our panel today. It's a panel that was alive with insight and energy, a constellation of voices, I think, that I know that will stir the room into thought. And I'm very confident that the dialogue today will plant seeds for possibly for bold ideas, deeper connections, and collective action. I'm going to just quickly introduce everyone. Let's start with Dr. Junka Gupta, who is an associate professor at George Mason University's College of Public Health. Her research focuses on gender-based violence, health disparities, and the health impacts of social determinants, particularly among immigrant and forcibly displaced populations. She has extensive experience in adapting and evaluating interventions to prevent intimate partner violence in diverse settings. Andrew Gibbs, Andy, like I called you Andy earlier and I didn't even check if that was okay. Sorry, are we good to go? Andrew Gibbs, who's a senior lecturer at the University of Exeter in the Department of Psychology, and is also an associate at the Gender and Health Research Unit at the South African Medical Research Council. Very precious to us here. Most of his work has focused on understanding and addressing intimate partner violence amongst young people in urban settlements in South Africa. Increasingly, Shalini Roy is a senior research fellow in the Poverty, Gender and Inclusion Unit at IFPRI. She is an economist by training. She co-leads the multidisciplinary cash transfer and intimate partner violence research collaborative hosted by the IFPRI and leads the research portfolio on equitable resources, access, and resilient livelihood opportunities. She brings substantial expertise conducting impact evaluations focused on gender and social protection, including experience co-leading studies of large-scale programs in collaboration with national governments, and has specifically evaluated the effects of transfer programs on intra-household dynamics in Bangladesh, Brazil, Uganda, and Mali. And last but not least, Nancy Glass, who is Professor and Independence Endowed Chair at Johns Hopkins University School of Nursing, who has 25 years of research experience in conducting clinical and community-based interventions across urban and rural settings, both domestically and globally, including in humanitarian emergency settings. Let me just also say that her program of research has focused on adapting, designing, implementing, and evaluating interventions to improve healthcare and other service system responses to survivors of violence, such as an increased access to safe and affordable housing, improved community safety planning, and increased economic and food security. I know that most folks probably didn't even need that because your work is well known. But let's just start there. And I'd like to set the landscape with an initial round to all of you to look at models of women and economic empowerment programming, to look at contexts and foundations. And Junka, if it's all right with you, may I start with you? Good. So your work has explored how to adapt the EASE Economic and Social Empowerment Program, originally successful in Cote d'Ivoire, for forcibly displaced populations resettling in the US. Through immersive theatre testing, researchers found strong support for the intervention, especially its focus on addressing financial and familial stress soon after arrival, but noted privacy and implementation challenges. So I think, Junka, what might be interesting for us is to know what were some of the most meaningful adaptation suggestions raised by forcibly displaced participants, to just hear what they had to say. If you could kick us off with that. Thanks so much.
Sure. Thank you so much. So, first, maybe I'll just tell you a little bit about what the theater testing process entailed. So for theater testing, what you classically do is you do the intervention in its original form with the new population that you'd like to adapt the intervention to. In this case, the original intervention was implemented in Cote d'Ivoire. We're trying to adapt it for refugees, forcibly displaced populations in the US. So what we did is we actually involved graduates of the original EASE intervention in Cote d'Ivoire and created videos of the sessions and showed them to forcibly displaced populations and service providers in the US in their full form. It was a 2-day process each, where we showed the videos and asked, what resonated, what did not, what needs to be changed, what's feasible, would you recommend to others? So I think one of the things that really resonated with populations in the US was just the idea that this was something that many of the refugees themselves felt that it could help them have a better life in the US. They saw it as something that could help address some of the real stressors of the resettlement process, where you're trying to find housing, job, learn a new language, all of those things. And what the refugees themselves said was that we wish we had this right away when we first arrived, because we probably have a much more successful life now. But on contrast, the service providers were really more trying to find a balance on timing. So because of many requirements that resettlement agencies face, there was a lot of concern that offering the EASE intervention so soon to arrival people would not have the cognitive space to receive the intervention. So I think it's just finding that balance there. I think another thing that came up was the privacy issues. So I think in addition to gender equity, there was also the intersection of broader structural issues such as anti-immigrant, anti-refugee sentiment. So there was concern that in a group setting where EASE would take place, just disclosing some of the real challenges that some couples and families would be facing. And yes, there was the stigma of IPV that we're all very familiar with, but it's also the issue of, am I the most successful at resettling? Are other people going to be better at resettling than I am? What does this say to broader society about our population? So I think navigating some of these issues around racism and housing and those things, in addition to gender equity, would be helpful.
Thanks so much for that. And, we don't have time for it now, but I am wondering, maybe you can pop it into the chat. what the funding constraints might be around this kind of work into the future, given the current geopolitical landscape. Move to you and to look at the RCT done in the DRC, which combined a couples program and adolescent-focused economic empowerment to improve adolescent mental health. Findings highlight links between food insecurity, poor spousal relationships, IPV, and youth well-being. Targeting both generations simultaneously offers a promising pathway for interrupting generational cycles of violence, combine parental relationship strengthening with youth economic programming in this context. Just to all the panelists, we'd like to have 2 rounds of questioning and also keep 15 minutes or so for the broader audience to have time to contribute. So if you could just try and keep your responses short and succinct. Thank you, Nancy. Over to you.
So thanks for having me. I'm going to just give some of 2 rationale for why we decided to integrate the work we had been doing with adults and youth related to interventions with our local microfinance team at Payadak in Congo. We had first focused on productive assets for rural families in the DRC. And when I say productive assets, we focused on animal husbandry, where we provided loans of animals. So in this case, pigs and rabbits for the youth. We're targeting youth, young adolescents at the age 10 to 14, sometimes 15, depending on the parents' discussion. So in our previous research that we have been conducting since 2006, and remembering this is once a post-conflict setting, but now it's again a conflict setting, that for many of these rural households, they had lost much of their wealth through in rural areas, which is often animals and land. So we wanted to work with them to really rebuild the wealth of the communities, the rural communities. But when we conducted this research at the time, we didn't have an integrated life skills sessions or reduction of gender-based violence program. We were looking purely at the providing this economic support. How could it improve health and reduce violence, increase safety within the household? And what we found is, yes, this could have an effect, a positive effect on households, but in those households where we saw more partner violence and more alcohol abuse, those households didn't do as well in the program. So that drove us to think more about what additional work we needed to add to this economic empowerment program. And then reading my colleagues' work here, we started to see how providing a gender-based, really focusing on relationships. And so our colleagues in Rwanda had developed a program called Indashikirwa, which was a couples intervention that really showed positive impacts for couples and reduction of violence. So our team in DRC adapted that program to what we call HICA, which means forward. And we developed an intervention to integrate the couples program, where we adapted the economic component, where we added a cash component for the adults around attending the program of HICA, because it is 22 weeks. So we really wanted to provide a cash support based on the work of colleagues here, how important cash can be. And then we continued the work with the children and with the economic empowerment. And what other thing we wanted to know is, how can we improve mental health and psychological well-being of young people in communities where there's no mental health care? And so we wanted to see if improving relationships between parents and children through an activity like animal husbandry, we could strengthen the relationship, not only between the parents, but also with the children, and improve their overall health. So those were the lessons we learned, and what has helped us adapt to the current model. Thank you.
Thanks so much, Nancy. It's fascinating to listen to how multidimensional approaches can, yield significant dividends. Shalini, I would like to move to you now. So your work has examined the long-term impacts of cash, food, and behavior change communication interventions on IPV in Bangladesh. And you did this work longitudinally. And also, you showed how sustained reductions in IPV were seen in some regions, primarily linked to cash transfers, improved economic security and women's agency. Contextual factors, including gender norms and climate risks, shaped where the changes lasted. And we know that this is an issue, right? In the North, cash transfers showed lasting impact even without the plus component. So what does that suggest about when and where behavior change communication is necessary? We can talk to us a bit about that.
Absolutely. So just as a quick recap, what we studied was a pilot intervention called the Transfer Modality Research Initiative, or TMRI. It was providing either monthly cash transfers or food transfers to poor rural mothers with or without an intensive group-based nutrition behavior change communication, or BCC. And this was in 2 regions of Bangladesh for 2 years. And as you alluded to, what we focused on was studying IPV impacts after the intervention ended, and importantly, the pathways for impact through 8 years post-program, so we could compare cash versus food, with versus without BCC, in the North versus the South. And so on your question, first, a general point. In order for an intervention to have long-term impacts on IPV, it needs to have long-term impacts on the pathways that affect IPV. But which specific intervention will have long-term impacts on those pathways is going to depend partly on the context. So in our mixed method study in Bangladesh, what we find is that during the program, all of the interventions we looked at, cash or food, with or without BCC in the North or South, they all reduced IPV. And that's because during the program, all of these interventions appeared to activate at least some pathways that we found reduced IPV. Most strongly, one was improvements in household economic security. This improvement in economic security, improving household members' emotional well-being, reducing poverty-related stress, including among husbands, which reduced triggers for IPV. Second, improving women's relationships with family members, including with in-laws who often instigate IPV in this context. Third, some improvements in women's empowerment, including them having a bit more say in how resources were used. And fourth, particularly for women who are participating in this group-based BCC, we were seeing strong improvements in their social capital and their community relationships, and therefore less isolation as they became better integrated in their communities. So those 4 pathways were during the program. But then 8 years after the program ended, we really saw that mainly the economic security pathway is what was being sustained. And that also was only in the North, and only, as you said, from the arms that got cash transfers, not food. The most consistent improvements were from the combination of cash with BCC, but those that got cash alone also showed improvements by 8 years post-program. So again, we see the sustained reductions in IPV where we see the sustained improvements in pathways. And we do see that cash transfers alone can lead to long-term reductions in IPV if the transfers are sufficient to lead to long-term improvements in a pathway, like economic security here. But it clearly depends on context, because within the same country, in the other region, in the South, we don't see the cash transfer intervention leading to sustained reductions in IPV or economic security. And just to add that we do see that while we're finding effects on IPV even without the BCC in the North, cash transfers alone are having impacts, we're seeing stronger, more consistent results with the addition of the BCC. So it's not quite as clear as needing it or not, but basically we see that the plus component activates additional pathways and strengthens IPV impacts even in the North.
That's fascinating. Thank you so much, Shalini. And, so the question to Andy is similar. In South Africa, the co-developed Stepping Stones and Creating Futures Plus intervention showed early promise in producing IPV amongst young men, in improving livelihoods and enhancing women's mental health. Delivered to small friendship groups, the program strengthened peer support and was well received, especially among women. Early outcomes suggest that SSCF Plus may outperform its predecessor, but a full-scale trial is still needed. So Andy, if you can talk to us a little bit about what motivated the shift from SSCF to SSCF Plus, and how did participants help shape that new format?
Thanks, and hi everyone. So just to kind of recap the outcomes for the original Stepping Stones Creating Futures, SSCF. So very strong outcomes in terms of economic outcomes and reduction in men's perpetration, but we didn't see, and this was one of the major gaps, any impact on women's experience of violence. Men and women, these are young people, they're not in relationships with one another the way we recruited. So one of our main things was we need to get an impact on reducing women's experience through involvement. We also saw that men's IPV, though it went down, even in the intervention arm, it remains high. So that needed to, we needed to do better. And finally, attendance was quite poor. These were just groups of young people recruited from informal settlements. So the way we tried to address this was we actually employed, or Project Empower, who we worked with over this project, employed 17 young people as young peer research assistants, and really worked with them intensely over about 18 months to almost 2 years, really to try and understand their lives. And through that, we kind of built up lots of interesting insights, and they also helped us kind of reconceptualize some of the key components of the intervention. And one of those things, I think we'll talk about this in a bit, is delivered to friendship groups. So rather than just finding young people from the same setting, we targeted and recruited friendship groups. Also a big focus on addressing poor mental health through various activities. I think young men especially were really quite clear that this was a big thing. When they talked about alcohol, they didn't talk about it as you normally think young men talk about alcohol as being something, lots of fun. They really recognized that alcohol was something they had to depend on to get through the challenges of their days. So they realized we needed to kind of tackle that. And so I guess they were the big components. By working with friendship groups as well, allowed a bit more flexibility. So that in summary is kind of how we thought about and worked with young people. So really intensely to create a new variant, something a bit more hopefully stronger than what we had before.
Andy, I'm going to follow up with you and just ask you to just briefly just take us a little bit deeper into what specifically about that peer connection and the friendship group helped achieve impact.
Yeah, so I think a couple of things. Some of it is to do with, in the original study, we saw that peer groups, rather than being supportive of change, created barriers. So we had lots of stories from young men, especially, who'd gone to the intervention, who would then try and enact change, but their friends who hadn't been part of it would come along. And we had a number of stories about going drinking. The young guys would say, oh, I don't want to go drinking, but their friends were like, no, come on. So by drawing them in, obviously we know that lots of behaviors are socially kind of determined and by peer networks. So trying to get a whole network to change would hopefully be better. So that's one thing. I think with the groups as well, especially in the women's group, when we brought kind of random women together, there was lots of competition and complexity driven by their own experiences of trauma and poverty, which meant instead of them creating quite supportive spaces, they would often have quite combative spaces, lots of kind of internal dynamics. And we found that with the friendship groups, we got through a lot of that quicker, and that they started to build kind of relationships. They were all friends, they knew one another, but it hadn't really gone beyond that. So it allowed them to get beyond those initial dynamics and really build a solid foundation for change. One of the things we've seen in the follow-up qualitative work is that there's a lot more kind of idea of connection going forward, and kind of these groups being kind of stronger friendship groups. So I think there are some of the ways in which they kind of function to improve outcomes.
Thanks so much for that. So we are in about 6 minutes. We have to go and open up to questions. So I'm going to sort of give Shalini, Jimka, and Nancy 2 minutes each, a minute and a half each. But Shalini, I wanted to start with you. And we know that when we look at the adaptation of programs, that we have to think about contextual realities and local contexts. So I was wanting for you to dive a little into how do regional and contextual differences complicate efforts to scale or replicate transfer interventions for IPV prevention. You can give us a short, sharp answer, please.
Sure. So when we try to scale or replicate these programs, we really want to think through how the components will affect pathways in the new context. So for example, in Bangladesh, we see that cash transfers were sustaining IPV reductions in the north, but not the south, because they were sustaining economic security in the north, but not the south. And one reason seems to be that the south is more climate affected, more disaster prone, has more saline soil, which makes agricultural livelihoods challenging. So we were seeing in the north, women during the program were investing in livelihoods like livestock rearing, homestead gardening, and to some extent they were able to sustain those livelihoods after the program ended, whereas in the south, that was much more challenging. And so to better adapt this for the south, one example would be to tweak the plus component to possibly provide training on a livelihood that's less sensitive to climate. Another quick example is the nutrition BCC. So we see in the context of rural Bangladesh, where female seclusion norms prevail, women are rarely outside the home without male accompaniment, that this is really transformative for them. They're meeting with other women in the village every week for 2 years. Other household members are invited so that they accept women participating. And we really see that this drastically changes women's social capital because they were so secluded before. It is possible that the same type of intervention might be less impactful in a setting where women already have more freedom of movement and potentially more socialization opportunities. So I'll just stop there.
Thank you. That's very interesting. So Jimka, my question to you is similar. You in the very interesting position where you can actually talk to us about the adaptation of a global, let me not use global north and global south. Let me use the adaptation of a low and middle income program being adapted to a high income setting. Can you tell us a bit about the adaptation of ease and what it revealed about the potential and the limitations for adaptation?
Yeah, sure. I mean, I think the potential is enormous. I think here in the US, the interventions that do exist primarily for forcibly displaced populations are more around screening, referring to services. About 70% of primary prevention interventions are in low and middle income countries. So I think we do have a lot we can learn and adapt. I think a lot of the shared risk factors are similar. EASE was designed for conflict affected settings where women may have more access to finances through group savings and just general structures that happen in post-conflict societies. So how to engage men in the process around gender norms and equity through a financial lens, all of that is applicable here, where refugee women may have more access in terms of working for the first time, more economic opportunities, whereas men may have to engage more in childcare. These are all things that were shared with us. And I think really the challenges have to do with the funding structures. We had a very unique funding mechanism from Robert Wood Johnson Foundation. It was designed to how to adapt interventions for gender equity from low and middle income countries to the US. So it was kind of one of those very unique and special RFPs. I think more of those would be helpful. Also, I think that the way funding works, I think, for instance, in Cote d'Ivoire, it was perfectly acceptable to do an RCT in a population where there's 10 different languages all at once. Here in the US, the way the funding mechanisms work is they really want you to be super specific to one population and not so much focusing on the shared exposures and risk factors. So I think more flexibility in the funding approach to these types of interventions here in the US.
Thank you for that. Nancy, I want to sort of round this panel off by thinking about dual generation approaches. And I'm wondering if you are able to share a story with us that illustrates the potential ripple effects of dual generation approaches.
Great, thank you. One of the things I think for our program of research in DRC, one of the key components when we do a randomized clinical trial is then to spend time digging into what that information is telling us through talking directly with the participants to learn more, hear their voices about what they liked about the program and what they didn't like. So one of the things we really wanted to understand is how could a program like this improve the relationship between the children and the parents based on certainly, reducing violence and harsh punishment, but better communication, working together on a project, for example. So some of the things we heard, some of the stories we heard from parents were they were very motivated to have their children engaged in, we call it Rabbits for Resilience, in the Rabbits program, because they felt like the children needed something to help them think forward for a future. Living in a post-conflict setting, many times the children are leaving school earlier and they don't have the resources to stay in school. And the parents really felt like this was an opportunity for them to have some cash by selling the rabbits in the market for $8 to $10 for school fees, for school materials, helping their family. And building confidence, and and also the parents liked the project because they could use the waste from the rabbits to fertilize the crops. The youth talked about feeling the ownership and having a sense of ownership, and felt more confident, more capable, more motivated. And they felt that would help them in the future. And so again, talking about well-being, psychological well-being in an area that's been impacted by violence, without having a specific mental health intervention, we started to see the children feeling more confident about themselves. And then they talked about the relationships, how they were communicating more, how the children were asking them permission now when they left the home to go search for resources for their rabbit, for food, or when they were playing with their children. And they were asking for help with the rabbits. They were asking their mother and father to help them with building the cage and engaging in the process. So that sharing, they said there was more communication and more respect from each other. And so I think those are that's the kind of information that really helps us think about how to improve the intervention, how to strengthen the communication and relationships between youth and parents. Thank you.
Thank you. That's so fascinating. I feel that we can talk all day about these programs. I would like to. I see that there are no questions in the chat. I would like to encourage you. You don't need to ask a question if you want to share something on the theme of women's economic empowerment and addressing violence against women and girls. Some of your experiences, please. Now is the chance, and you don't necessarily need to put it in the chat. You can also put your hand up and talk directly with us. In the interim, while I'm waiting, so if I'm going to give an opportunity for hands to go up, but I want to maybe ask each of the panelists in the interim to think about, and this is the age-old question, the question of scale. So in your context and the work that you've been doing, what are some of the challenges in getting to scale? What does scale look like? And maybe, Shalini, can we start with you?
Sure. So is the question specifically the one in the chat about funding and replicating the programs, or just to make sure I answer the right question?
Which one was that? Was that the one from Wendell about the funding?
Yes. Or is
Sure.
it a question of scale?
You can answer Wendell's first, and then
Okay,
we will
sure.
to somebody else.
Sure. So, I mean, I can answer both kind of in a related way. So I think speaking specifically to cash transfer programs and some of the in-kind transfer programs, these often are already implemented at very large scale. These are often part of large government social safety nets, and they are already targeted to households often who are at high risk of intimate partner violence because they're often targeted to poor households or vulnerable in other kind of demographic characteristics. And so these programs do already have, they're already at scale. They already have, well, so recently now there's a lot more, I think, challenges with funding for food assistance. Previously, it had quite a robust donor base. But what we do know is that these programs scale quite well because the pathways tend to scale quite well in the sense that, these programs are really focused on economic security. And so during the program, provided the program is implemented well, cash transfers tend to be very effective at reducing intimate partner violence. What our study speaks to is more kind of post-program, and there it seems to vary more, really depending on the program design and the context. But in terms of replicability of cash transfers and scale, those are very solid in terms of the evidence.
Andy, stepping stones.
Yeah, so we've had some interesting kind of experiences trying to deliver through government mechanisms. So Project Empower, I think it was funded by GIZ, so the Germans. So Project Empower did all the implementation of the intervention, and they got funding to try and work with a number of municipalities in South Africa to deliver Stepping Stones Creating Futures Plus, or some variants on it. And I think what they found was that often without very clear kind of government structures and systems in place, they struggle to get uptake. So they could do stuff like training of the trainers, but then the delivery mechanism was very complex, and often very small things would cause problems. Who was going to buy food for the training process? Things like that, because there wasn't a very clear mechanism within the South African government structure for delivery of these kind of participatory kind of interventions, even though there is kind of expanded public works programs. So they found it really, really hard. But we've been much more successful when there has been large inputs of US foreign funding through, and or the Global Fund, that NGOs have been able to deliver these kind of interventions. So I think, yeah, government for us has been very complex, although things have changed again. And there's new guidance in South Africa about who has responsibility for these interventions. So we aim now to be able to tap into that kind of mechanism. So it's all where these opportunities open and close in some ways, and finding those mechanisms.
Yeah, and the challenge is that they keep shifting, right? It doesn't stay, it's not static.
Absolutely. It keeps changing, and who's in charge and who's got interests. So, yeah.
Jimko, if you can talk to us about ease and scale, especially in the current context, like, yeah.
Sure. I mean, I can say that EASE outside of the US, I mean, EASE is a intervention from the International Rescue Committee, who is my NGO partner. And outside of the US, it's been implemented in about 14 different countries since our original RCT in Cote d'Ivoire. But in the US, I think, as you all know, that's slightly more challenging right now. I can say that at least our proposal to implement EASE US was received very favorably, and actually approved for funding at NIH, and we are anxiously waiting a notice of award. We don't know if it will happen, but it has been approved. So all to say that there is interest, but I think having to be a little more creative with fundraising right now.
That's such a difficult issue right now, the funding landscape, and how this work is potentially undermined by the challenges. Nancy, I'm going to actually ask you to respond to a question in the chat, which is about, do presenters believe that these attitudinal and behavioral changes experienced during the intervention last a lifetime, or are these mostly short to medium-term changes?
I think it's a very important question, and one that we've been trying to answer. And by following the individuals and the families over time, unfortunately, our funding cycles are usually 4 to 5 years. So, what Shalini did with 9 years is the type of evidence we really need to start working on, having that long-term understanding. But I do think skill building that we're trying to do with the young people will have at least a medium, I think potentially longer term impact. I think the couples intervention, we're seeing Indashakira adapted to many settings with some really positive, findings. There's always periods of adaptation of these interventions and scaling them. We're following the families for we hope to have for like over almost 2 years. However, we're going to have a little bit of a challenge, because when we first implemented, the villages were safe and calm. Since we've implemented, there's been a rebel force in Bentois who's invaded the area, and there's been displacements of the families, etc. So it will be interesting. We're collecting data now as a follow-up to see how that has impacted these families, because we certainly think it will, and that's informative in and of itself. So I think that there's potential for some medium to even long term, but we do see the short-term benefits. What we need is better long-term studies to follow the families over time.
Thank you, Nancy. We're going to have you back once you have the findings. I'm going to now hand over to Wendell. I hope you enjoyed this as much as I did, Wendell.
Oh, thanks so much, Joy. It's been such a lovely session, and thank you to all the participants and audience members for joining us today for these really rich discussions. And I've so enjoyed hearing about the different projects that have been shared today. It reminds us of the importance of these sorts of spaces where we can come together and to learn and share. So thank you to the SVRI Forum for organizing these, continuing these discussions into these spaces. So our particular thanks to our speakers, Jumka, Nancy, Shalini, Andy. Thank you for your valuable contributions. To Liz, thanks for grounding us in sharing the forum findings. And especially to Joy for her thoughtful moderation and for guiding us through today's session with such care and such insight. Thank you, Joy. So we as the Australian Volunteers Programme are so pleased to be a part of this series, and we so value the partnership that we have with SVRI. So please check out the details for our June webinar. The next focus area is around intimate partner violence and its intersections. So that will be in June, and it would be lovely to have you there and share the webinar details with others. It's a really important space for us to be able to get together. So if you're keen to stay connected, please sign up for the SVRI newsletter. And you'll get all the updates about the SVRI Forum 2026. I was fortunate to be a part of the 2024 forum, and it was such an amazing experience, and I would recommend it for anybody to join in. It really was such an insightful and empowering space to be a part of. So please sign up for the newsletter, get involved, share your abstracts, and register online so that you can join in on the discussions. So thanks, everyone. It's so lovely. And it looks like we are right on time. And it's been such a lovely session. So thank you, everybody, for joining us today. And hopefully you have a lovely evening wherever you might be. Thanks, everyone. Take